Well, my name is Rita. I have a problem. I can't talk without using my hands, so this presents a real obstacle. The first thing I want to do is thank everybody for being here. Thank Katie Robbins, thank Laura Wen, and in my heart, thank Marilyn Clement, who understood the South, and we're so grateful that she did. And I think, we need to remember that. I don't know where to begin. I certainly agree with Sandy. I work at Grady Hospital, which used to be the only large county hospital in the Southeast, the biggest trauma center in the Southeast. In 2007, we held the first United States Social Forum in Atlanta, Georgia, and brought in, roughly 15,000 people from around the country who were engaged in grassroots struggles for various issues: housing, undocumented workers, health care, you name it. And we marched from the state capitol through the city of Atlanta, and we passed Grady Hospital and demanded health care for all at Grady Hospital. At the same time that was happening, the Georgia Chamber of Commerce was about to take over Grady Hospital. The only county hospital, again, only public hospital that had a mission to serve the underserved, and had to do that. The coalition that was built was called the Grady Coalition, and we fought for a year to try to prevent that from happening. And in the process of that coalition, I've been involved in single payer since when was the New England Journal of Medicine article, Quentin? No, 89, there you go, for 20 years, and I'm only 32, so there you go. So, for a very, very long time. And we brought, within that fight, to keep Grady public, the issue of single payer, because it became utterly clear that the only way a hospital like that, or Braddock, or a clinic, or any system of healthcare could survive was with a national public health insurance system. It's simply not viable any other way. And we were able to, from each one of these grassroots struggles, build up more and more momentum, because after all, we're all here, right? Because we believe, we really do believe, and we understand that the extraction of profit from a healthcare system is absolutely incompatible with the delivery of healthcare. Is that true? I mean, we cannot have that system. One of the thing that's happening now at Grady, now that the Chamber of Commerce has taken this struggle over, is to close Grady dialysis, okay? Now, most of you know, my fellow nurses and social workers and doctors, that, anyway, to make a long story very short, what that really meant was that people that could not qualify for Medicaid, i.e. the undocumented, would lose access to dialysis. And that struggle began to get folded into the single payer struggle. One of the things that was so interesting about it was that new healthcare fighting groups are springing up all over the place. This is part of that movement. And I guess that part of my recommendations are the following things. One is that we have to assess where this movement is really at. And in order to go forward, we partly have to reach back to people that we've been talking about here that have a vision of equal quality health care for all, right? We come from a history in the South of the Civil Rights Movement, of course, and the country as a whole. And we know that a movement is what forces change. The Civil Rights Movement was fighting for freedom and equality. It wasn't fighting for the Voting Rights Act or Medicare or Medicaid. Those were byproducts of that struggle, right? And it was a situation where the movement directed the legislative course, not vice versa. And that's the kind of struggle I think we have to engage in now. In closing, this question of vision, I've talked to a lot of people like you all have, right? and they're for healthcare reform. And some people know what that means, and some people don't. And of course, we're policy wanks, so we're real clear about what all that means. But what's in people's minds is that we want the highest quality, compassionate healthcare we can possibly get without worrying about money. That's the vision. That's what we have to push forward, and we understand that national public health insurance is the way to achieve that in the short term, right? But we need to overhaul the whole healthcare system. We know that too, don't we? Right.
Yeah.
So I think that what we have to do is hook up with what Sandy was saying, what everybody was saying. These grassroots struggles, regardless of what happens in the legislature, are going to explode, right? And they're already exploding because people don't have access to health care. We need to get into that struggle. And one of the other vehicles to begin to develop toward that is the United States Social Forum in Detroit in 2010, which is an expression of what happened in New Orleans in 2007. It just took a lot longer to get there. So I thank you all for being here. I'm very excited about our possibilities. And it's this vision that I think we have to carry forward.